How is a core biopsy used to diagnose TB? Have you ever wondered how doctors diagnose tuberculosis, especially when it affects areas outside the lungs? One important method is through a core biopsy. This procedure is minimally invasive and allows healthcare providers to take a small, cylindrical sample of tissue from a suspicious area, like an enlarged lymph node or a lung mass. The goal is to check for the presence of Mycobacterium tuberculosis, the bacteria responsible for tuberculosis. Core biopsy is particularly useful for diagnosing extrapulmonary tuberculosis, which is when the infection occurs in areas outside the lungs, such as lymph nodes. In these cases, obtaining tissue samples is crucial for accurate diagnosis. The procedure is often guided by imaging techniques like ultrasound or computed tomography to ensure the needle targets the right area. Compared to fine needle aspiration, which uses a thinner needle, core biopsy provides a larger and more intact tissue sample. This is important because a better sample can lead to more accurate results. Research indicates that core biopsy has a sensitivity of about 95% for detecting tuberculosis in lymph nodes. This level of accuracy is similar to that of excisional biopsy but is less invasive and can often be performed using local anesthesia. During the procedure, a hollow needle is inserted into the lesion to collect multiple strips of tissue, usually between 2 and 4 strips, each measuring over 5 millimeters in length. Once the tissue is collected, it undergoes histopathological analysis to look for granulomas and caseous necrosis, which are characteristic of tuberculosis. Additionally, microbiological tests, including cultures and molecular assays like expert MTB-RIF, are used to confirm the presence of the bacteria. Core biopsy can also be applied to diagnose tuberculosis in other areas, such as lung masses or bone lesions, especially when sputum or blood tests do not provide clear results. The ability to obtain a definitive tissue diagnosis helps differentiate tuberculosis from other conditions, such as cancer or different infections. In conclusion, core biopsy is a vital tool in diagnosing tuberculosis, particularly in cases where direct tissue evidence is necessary. It offers high diagnostic accuracy and is less invasive than surgical options. This method helps ensure timely and appropriate treatment decisions by confirming tuberculosis infection through a thorough examination of the collected tissue. Always consult a healthcare professional for personalized medical advice regarding tuberculosis diagnosis and treatment.